But as an aside, there's this whole notion of laser hair. And these are old statistics, but we all know that in our current society, being hairless is of value to most of your patients. Most of your patients are seeking hair type of treatments, hair removal treatments, that is. And so here's the thing about hair that I hated when I was trying to consider, like, should I or shouldn't I, is that if I got a device that only did laser hair, it was, number one, very, very expensive device, and laser hair, everyone's racing to the bottom, and those are low yield in terms of revenue procedures. So you buy an expensive device for a low yield revenue producing procedure, that's not a good equation, right? And so I'm like, gosh, how do I play this game because everyone's racing to the bottom? And then when I got my first tiptoe into laser hair was because I got an Optimus many, many years ago. And on the Optimus just happened to have hair. And so my Optimus is generating revenues utilizing all the other service lines. And oh yeah, it's got hair on it as well. So that was our first segue into hair because I didn't have to buy a standalone device. So I appreciate so much that this does hair. And it's an easy way to enter into this space because the way I use laser hair mostly, now thankfully we're getting to the point where my estheticians do most of our laser hair treatments, or laser technicians. We're actually pretty busy on that side of the clinic, but before, the best value of being able to offer this service was retention for your patients. What do I mean by that? Your patients are leaving to go get their bikini lines waxed or lased somewhere else, right? They're leaving you to go do that. Everybody's doing it. So if you don't have it, they're leaving you, and it might be likely that whoever they're going to has all the other things that you are also doing. So at first, I really utilized my hair to retain my patients because what I noticed is they were going all over because I didn't offer it. So they were going elsewhere, and I never see them back. So at first, it's a good play for retention of patients. We've got one option that you should consider, and then there's some other specific options which I'll kind of position all on this device. So the one I started with is this diode laser. It's an 810. Which is the gold standard wavelength. It's the most efficient. You got to be careful in 5s and 6s. You can use it, but you just low and slow, because it's the chromophore is melanin. So it sees melanin in the hair bulb, and that's the target, shoots it, and kills the hair follicle. Well, again, I've got a lot of melanin. Tattoos you also have to be careful for, because it sees tattoos, ink in the skin, and you can burn someone. So careful in 4, 5s, and 6s and over tattooed skin. And basically what this is telling us in the interest of time is that InMode has strategically taken the gold standard wavelength and fluence to maximize efficiency. So they have tuned this thing to be maximally efficient, and that is driven in some of the literature I'll show you. We're showing 70 to 80%, depending on which handpiece you're using, clearance. 70, 80% clearance with 3 treatments. Classically, what are we telling our patients with? I had other laser hairs before, and I know you do too. It's like 6 and 8 and 10, right? So 80%, 70 to 80% clearance with 3 treatments. That's very efficient. We also were one of the first to have a chilled tip. Doesn't sound like a big deal nowadays because everyone's doing that, but if any of you, I won't make you raise your hands, but if any of you have had any laser hair removal done in an intimate area, you know that could be a little spicy, right? And this next clip will show you kind of the value of having a chilled tip.
I started getting laser hair removal, essentially all over my entire body, okay? And so when they do your front downstairs, they're gonna do your back downstairs, okay? And when they do your back downstairs, they make you spread them. I don't like doing that. Like, essentially, like, I've been there at this point probably like 12 or 13 times. That means 12 to 13 more women have seen my butthole than men have. It's just, I just throw it out on the table for you. So because I don't like to spread them, I will just let the lady kind of just like go in there blind. And so this one of these last times, she went in there blind, didn't know where she was shooting, shot it right into my butthole. Right into my butthole. When I tell you the scream in which I scrimped, I have never scrimped before. I swear to God, the laser shot right out of my mouth. Shot right out of my mouth. Started lasering things down. I was lasering all over the place. The glasses were breaking, light bulbs were shattering. I looked like a lighthouse, like William Dafoe. So, if you go get your butthole lasered, make sure that you spread them. They don't care.
See all the things we're learning together as a group of colleagues this week and the importance of chilled tips, right? There's the data I referenced, 70% at 1 year with the diode laser for this hair. So that's pretty good clearance with just 3 treatments. So this is 3 treatments, 70% clearance at a year. And then, of course, I'm going to flip through these results because there's nothing sexy or fancy. It's a hairy arm, now it's a bald arm. You guys get the point. We got cooler before and afters coming your way this afternoon and later this morning.